Okay, so welcome to Shire's Medical Academy. Now, I'm sure you guys are wondering like how to exactly prep for this AMC exam. You got your books, you got your question banks, but how to exactly use these? Well, to answer that question, we got Dr. Shire over here who's going to explain everything. Doctor, could you please help us?
Yeah, thank you so much. So I'll explain everything from what I have taught in this 9 year to different uh, like doctors, medical students, and those are like the aspiring doctors want to move to Australia. So like I'll tell like the five most important thing actually here,
Okay.
and usually we call in our academy as a like five pillars actually. So that actually includes like theory, that also includes recall,
Mm-hmm.
that also includes question bank,
Question banks.
and then also includes mock at the
Mock.
same time, and lots of like with the study partner discussion in different forums.
Okay.
Okay, so I'll come one by one. So first of all, like let's say if it's theory. So for the theory, like most important thing is the John Murtagh, any latest version of John Murtagh. Another commonly asked, can I use the previous one? No, that's the thing. So you should mark it the important segments. It's a like almost 1600-page book. You don't need everything. So only the specific topics you need, because that's the book also for the general practitioners in Australia. They also read this book, and so as the AMC uh, doctors who are preparing for the exam, they also prepare. So you need the specific part from that particular book. At the time we are recording this video, it's like ninth
Ninth
edition
edition,
is in
yeah.
the market. So John Mutta's specific study, not everything. Then comes like some exam specific note, and now exam specific notes are like the SMA notes, all right, like which we supply from our academy. Every single topic there's, apart from that one, like every system there can be, we can reference one or two textbook other than the John Murtagh's, which I think when people come to courses we mention that, but generally speaking I think Kaplan can be an alternative, because when you are studying John Murtagh and SMA notes, if someone wants to open a reference book, let's say Davidson, you can keep it open for the medicine actually, and in some other topic, generally speaking, like maybe Kaplan can be a good idea. So that's the theory part. Now comes the recall. Recall we do in our 5 months courses, also in the 3 months courses.
Mm.
Recall system wise is also important, month wise is also important. Whatever you can, you do. I mean, as much as you can. So that goes with the recalls actually. All right. So recall in the classes and also outside classes as much as you can. There's nothing like someone can guarantee you like you just do this recall and you'll 100% pass. It's not possible. I'm the most experienced tutor, I can tell that. So you cannot like put eye on like one finger that, okay, just do so some scammers do that, just do this recall and you will pass. It's nothing like
Yeah.
that. You need to also increase your own caliber at the time of solving the recalls. Like if you're just doing a recall and memorizing it, you're not going to pass. You should do a recall at the same time. The options, like let's say you have confusion between two options, the next time you will again have the same confusion between those two options. So you should know about those two diseases, the close diseases, very well actually, when you are solving a recall. Recall, by the way, is like something which actually when anyone going for the exam and they as much as they can and they recall it, and they also give it to different forums, and that's how we collect it. That's called AMC recalls actually, and it's directly most important, even more important than a question bank. Now this brings us to the point that the question bank. Now there's so many question banks in the market. There is like Amedex, there is
The big
like
one.
Mplax,
Mm.
there's like eMedicine, there is like AMC Q Bank actually. So we have like 4 or 5 different question bank actually. The last one came as a eMedi, so maybe that's the latest one. But for many years, Amedex has been ruling, yeah, like trusted at the same time. eMedi, it's also maybe new, but it's too big. Maybe a lot of AI been used in that one, what I have seen. Yeah, and so you can do one question bank properly. That's all you need actually. And you need to find out the important topics. Like even in the question bank, sometimes too many. So you need to find out like the relevant. So, but it's very difficult in question bank to find out relevant ones actually. And often the question bank question does not match with the recall, because with the same pulmonary embolism, I can make 25 types of question
Yeah.
and 25 type of topic. It doesn't mean that every single thing from pulmonary embolism is important. You need to go specific which comes actually in the exam actually. So that's one of the thing. And apart from that one, the question bank. So you choose one question bank, you finish it one time and revise it one time. At the time of solving the question bank, if you do it real time, you can mark those you have errors. But if you're solving some downloaded question bank, probably you need to take notes that where you have problem. So this is one very important tip. And last but not the least, mock test. The small mocks, large mock, whatever type of mock, but real-time computerized mock, which we also take actually, the real time as like the computerized one with like 3.5 hours. Those are game changers, and we made it from actually recalls, not from question banks actually. So those like the genuine one is highly recommended, not like a question bank mock where you will not probably get the real type of scoring actually. And last but not the least, the forum discussion actually. So about the forum, like Shari's MC guideline is probably the largest forum for MC discussion. You can search any topic and find out, let's say respiratory, cardio. So you can check any topic, comment or repost it at the same time, may help you actually like solving. So these are the things we know we definitely suggest you in the classes. And the last thing what I say in the classes is 5 hours a day, 5 days a week for 5 months. You should continuously study, and at the end study a little bit more by taking break from your job actually. There's a lot of more tips and tricks we say in the classes. I hope you can join our academy for that.
All right, so there you have it.